The symptoms of Alzheimer's disease progress slowly over several years. Sometimes these symptoms are confused with other conditions and may initially be put down to old age. The rate at which the symptoms progress is different for each individual. In some cases, other conditions can be responsible for symptoms getting worse. These conditions include infection, stroke, delirium. As well as these conditions, other things, such as certain medicines, can also worsen the symptoms of dementia. Anyone with Alzheimer's disease whose symptoms are rapidly getting worse should be seen by a doctor so these can be managed. Generally, the symptoms of Alzheimer's disease are divided into 3 main stages. Early symptoms. In the early stages, the main symptom of Alzheimer's disease is memory lapses. For example, someone with early Alzheimer's disease may forget about recent conversations or events, misplace items, forget the names of places and objects, have trouble thinking of the right word, ask questions repetitively, show poor judgment or find it harder to make decisions, become less flexible and more hesitant to try new things. There are often signs of mood changes, such as increasing anxiety or agitation, or periods of confusion. Middle stage symptoms. As Alzheimer's disease develops, memory problems will get worse. Someone with the condition may find it increasingly difficult to remember the names of people they know and may struggle to recognize their family and friends. Other symptoms may also develop, such as increasing confusion and disorientation, for example, getting lost, or wandering and not knowing what time of day it is. Obsessive, repetitive, or impulsive behavior delusions, believing things that are untrue, or feeling paranoid and suspicious about carers or family members. Problems with speech or language, aphasia, disturbed sleep, changes in mood, such as frequent mood swings, depression, and feeling increasingly anxious, frustrated, or agitated. Difficulty performing spatial tasks, such as judging distances, seeing or hearing things that other people do not. Hallucinations. Some people also have some symptoms of vascular dementia. By this stage, someone with Alzheimer's disease usually needs support to help them with everyday living. For example, they may need help eating, washing, getting dressed, and using the toilet. Later symptoms. In the later stages of Alzheimer's disease, the symptoms become increasingly severe and can be distressing for the person with the condition, as well as their carers, friends, and family. Hallucinations and delusions may come and go over the course of the illness, but can get worse as the condition progresses. Sometimes people with Alzheimer's disease can be violent, demanding, and suspicious of those around them. A number of other symptoms may also develop as Alzheimer's disease progresses, such as difficulty eating and swallowing, dysphagia, difficulty changing position or moving around without assistance, weight loss, sometimes severe unintentional passing of urine, urinary incontinence, or stools, bowel incontinence, gradual loss of speech, significant problems with short and long-term memory. In the severe stages of Alzheimer's disease, people may need full-time care and assistance with eating, moving, and personal care. Read more about how Alzheimer's disease is treated. When to see a GP. If you're worried about your memory or think you may have dementia, it's a good idea to see a GP. If you're worried about someone else's memory problems, encourage them to make an appointment and perhaps suggest that you go along with them. Memory problems are not just caused by dementia. They can also be caused by depression, stress, medicines, or other health problems. A GP can carry out some simple checks to try to find out what the cause may be, and they can refer you to a specialist for more tests if necessary. Alzheimer's disease is thought to be caused by the abnormal buildup of proteins in and around brain cells. One of the proteins involved is called amyloid, deposits of which form plaques around brain cells. The other protein is called tau, deposits of which form tangles within brain cells. Although it's not known exactly what causes this process to begin, scientists now know that it begins many years before symptoms appear. As brain cells become affected, there's also a decrease in chemical messengers, called neurotransmitters, involved in sending messages, or signals, between brain cells. Levels of one neurotransmitter, acetylcholine, are particularly low in the brains of people with Alzheimer's disease. Over time, different areas of the brain shrink. The first areas usually affected are responsible for memories. In more unusual forms of Alzheimer's disease, different areas of the brain are affected. The first symptoms may be problems with vision or language rather than memory. Increased risk. Although it's still unknown what triggers Alzheimer's disease, several factors are known to increase your risk of developing the condition. Age is the single most significant factor. The likelihood of developing Alzheimer's disease doubles every 5 years after you reach 65. But it's not just older people who are at risk of developing Alzheimer's disease. Around 1 in 20, this is called early or young onset Alzheimer's disease, and it can affect people from around the age of 40. Family history. The genes you inherit from your parents can contribute to your risk of developing Alzheimer's disease, although the actual increase in risk is small. But in a few families, Alzheimer's disease is caused by the inheritance of a single gene, and the risks of the condition being passed on are much higher.